Good day, ladies and gentlemen. My name is Florian Landman, and I'm going to do a quick overview of the Discovery core plans for 2023. The core plans are basically your hospital plans with Inside Discovery, and there's 5 of them: the Classic, Classic Delta, Essential, Essential Delta, and Coastal Core. And let's look at some key features for Discovery. So first of all, which is important, you've got unlimited cover for hospital admissions at a private hospital. You've got your 27 chronic disease list conditions that are covered. You've got access to connected care, which is home care options that are available. There's extensive care for pregnancies, and then you've got some screening and prevention covers. Those are your blood pressure, blood sugar, and those kind of things. You've got cover if you travel abroad, and you've got access to your new health fund. So let's just look at some terminology on this. First of all, the classic portion, or the classic plans, offers you 200% cover in hospital. Please note that a doctor has the discretion to charge whatever he would like for hospital procedures, so they can charge above scheme rates. And if they charge above scheme rates, that's when you need a gap cover. So on your essential plans, you are covered for 100% of the Discovery health rate. So if you take a look at an example here, say you want to remove your appendix, and the 100% Discovery health rate to do that for the surgeon is 5,000 Rand. That surgeon can charge anything from 5,000 to 10,000 to 20,000, depending on how good he is, how difficult the procedure is, and many other factors that has to be taken into consideration. So on the classic plans, you would basically be covered for 10,000 Rand for the same procedure. But please note that you can still be out of pocket if the doctor charges above 200%. This is true for all specialists, so anaesthetists, orthopedic surgeons, any kind of specialist that you see in hospital. The Delta portions, very easy, just means that you've got to make use of a Delta network range of hospitals. And if you do not use those hospitals, there is an excess or a co-payment that you'll have to pay. And then lastly, we've got the Coastal Core plans, which is also 100% rate, Discovery health rate that pays out. And the Coastal plans are basically hospital plans where you have to go to, you can go to any hospital in any province in South Africa that has a coastline. On Discovery, you do have cover for emergencies. So you do have cover in an ambulance if there's any emergency or where it's a life-threatening situation. So make sure that you've got the app and make sure you've got the number saved on your phone. Discovery, you also have cover for PMBs, which are prescribed minimum benefits. This is a minimum level of care that all medical schemes has to cover according to the Medical Schemes Act, and it's a list of 271 conditions and the 27 predefined list of chronic conditions. So you do have cover for that as well. There are several screening and prevention benefits. So some of the more popular ones are your blood sugar levels, blood pressure, cholesterol, BMI, and HIV screening. Discovery also provides cover for pap smears and PSA testing. Please note that these tests, the prevention benefits, the test is covered, and the consultation from your doctor or your specialist or your pharmacy to have these tests done would be for your own pocket, except if you've got your wealth fund activated, but we'll get to that in a little bit. So on the wealth fund, this is a new benefit that's applicable for 2 years. All new members will have access to this from joining for the next 2 years. And to get this benefit, it's very important that everybody on the policy has to do a health check. And then once that is done, this benefit is activated automatically. So everyone older than 2 years old on your medical scheme has to do this. And then they allocate 2,500 Rand per adult and 1,200 Rand per child, up to a maximum of 10,000 Rand. There's a range of benefits on this new wealth fund that would be covered. And one of the things is if you go for your health assessments or your health checks and you do your blood pressure and blood sugar and all of those things, the consultation will actually be funded from this and not from your savings or out of pocket. You can go through this. There's a lot of things: mental health, physical health, general health, children's health, and certain medical monitoring devices that will be covered from this fund. With regards to the World Health Organization, the global outbreaks, you are covered in full for conditions like COVID-19 or even monkeypox. So you can reach out to our office. Should you be diagnosed with one of these conditions, we can assist you with explaining how the benefits work, what you need to do, and what is available for you as support. Connected Care is an absolutely wonderful tool with Discovery. Make sure that you download the app. This gives you access to electronic consultations or virtual consultations with doctors. There's home-based nursing available in certain situations, electronic prescriptions so that you do not have to wait in a queue. You can also get certain devices where you can do health monitoring at home, and absolutely fantastic tool to get in touch with doctors. Okay, maternity care. If you are pregnant or if you are planning to start a family, you do have wonderful maternity benefits with Discovery. So the first thing is that they pay for 8 consultations before you deliver your baby, so antenatal consultations with your gynecologist, GP or midwife. They do cover 2 2D ultrasounds. A 3D and a 4D scan will be paid up to the 2D scans rate. You can go for a flu vaccination if you are pregnant. There's a basket of blood tests that you can go for. And then if your baby is under the age of 2, they can go to 2 GP visits or pediatrician visits or an ENT if they were born on Discovery. There are also some antenatal and postnatal classes that are available that you can check out. The core plans, you've got cover for your 27 chronic conditions. You can get a full list of conditions from our office, but generally these are things like high blood pressure, high cholesterol, diabetes, bipolar disorder, and certain thyroid conditions. There's a formulary of medication that you've got to use. If you do not make use of medicine on the formulary, please know that the medicine will not be covered in full, but there will be a rand amount that's allocated for it. All chronic medicine has to be registered with Discovery. So if you do have a chronic condition and it's not registered, reach out to us so that we can assist you with the registration process and that we can get those benefits covered for you. Here is a list of the conditions that are covered. You can pause the video here just to check whether one of these conditions is applicable to you. So you can get your chronic medicine from any pharmacy, but if it's not a network pharmacy, there may be a 20% co-payment. So you can use a MedExpress or MedExpress network pharmacy. The lists are available online, very easy to see, and very easy to order medication through the app or through the website. Most Clixes and Discoms form part of the MedExpress network pharmacies, and then you can avoid those co-payments. There are certain care programs with Discovery. So if you do suffer from certain illnesses like diabetes or HIV or mental health, you can check that once your condition is registered, there would be tailor-made programs for you specifically to remind you to take your chronic medicine, to assist you with certain consultations, certain blood tests, things like that that's specific to you. And if you've got any one of these conditions, you can reach out to us and we can assist you with registering for it. With Discovery, you've got very comprehensive care for cancer. The limits were increased from 2022 to 2023 from 200 to 250,000 Rand in a 12-month cycle, meaning if you are diagnosed in July, your benefit would run from July this year to June the following year. Once your benefit amount has been depleted, it is unlimited going forward, but there would be a 20% co-payment. This co-payment can be claimed from a gap cover benefit. So make sure that you have a gap cover. That's important. And if you do not have one, reach out to us, then we can assist you. Okay, your hospital benefit kicks in when you are in hospital. You've got a bed that you lie in, you've got a band around your arm, and there's a clinical reason or medical reason for you to be admitted in hospital. It's unlimited cover up to your scheme rate, which can be either 100% or 200% with Discovery. And make sure that you always use the correct hospital or the correct day hospital so that you don't have any co-payments. All right, so the hospital cover with Discovery. Once you have been admitted to hospital, the account will be paid in full up to the Discovery health rate. Just note that on the Delta options, there will be a co-payment of 9,650 Rand if you do not make use of the correct Delta network hospital. Coastal plans will be a 30% co-payment, and then for certain day surgery procedures, there's day surgery network on the Delta options, there's a 9,650 Rand co-payment. All other options, if you don't go to the right hospital, 6,300. Just take note that if Discovery has a contract, an agreement with a specialist, they'll pay the amount, the doctor's account in full. If they don't have an agreement, it would either be 100% or 200% of the agreed Discovery health rate. X-rays and blood tests are covered up to 100% with Discovery. The same with your MRI and CT scans, which will be covered up to 100%. Just make sure again with your MRI and CT scans that on your core plans, it has to form part of your admission. If it does not form part of your admission, if it's diagnostically related or outside of hospital, it will not be covered. Just some more co-payments to be aware of. There are upfront co-payments on scopes. So on your classic, essential, and coastal and Delta options, it is 4,050 Rand. If you do a gastroscopy and a colonoscopy at the same time, it's 4,950 Rand. That's for a day clinic. If it's inside of an hospital, it is 6,950 or 8,650. If there is a doctor that's part of Discovery's network or value-based network, it will be reduced to 7,200 on your, if you do both of them, and 5,750. Please remember that all of this is claimable from a gap cover, so make sure that you have one if you do not want to cover these expenses, and if you don't have one, please reach out to us. Furthermore, if it's a PMB condition, in other words, it's life-threatening or one of that 271 conditions, then no co-payment is applicable. There are some benefits with annual limits, meaning that you've got a set Rand value that's covered for it. These are things like cochlear implants, major joints like a hip or a knee replacement, shoulder joints, mental health and alcohol and drug rehabilitation. So if you make use of any of these, please make sure that you stay within the limits. Where it's a prosthetic, there is cover available on a gap cover. So make sure that you have a gap cover, then there are additional amounts that you can claim on there. Right, in hospital dental, please just take note that there is a co-payment for upfront payments for dental admissions. So your hospital account, 7,800 Rand, or in a day clinic, 5,000 Rand. If you are under 13, it's 3,000 and 1,350 Rand respectively. This is usually the case where it's for something that's removed, like wisdom teeth or impacted teeth, where it's got to be surgically removed. It's a good benefit. Many medical schemes exclude this, and then you cannot go for a procedure or is paid very limitedly. This again is covered in full from your gap cover, so make sure that you have one. If you don't, please reach out to us. Right, I have spoken about this, the co-payments in certain day clinics or day surgery networks. So please make sure that you go to the correct hospital for your plan type. Here is the list of day procedures that's covered in a day surgery network. You can pause the video here and just have a look at it. These procedures are usually things that you can recover from at home, and it's very minor or it's not very invasive, and that's why it is covered in a day surgery facility. There are some extra benefits on your plans. So trauma recovery benefit if something severe happened to you. You've got 6 counseling sessions with a psychologist. You've got your international travel benefit. You've got a spine care program to make sure that you don't hurt your spine or to prevent spinal surgery. There's certain cover that you can get in doctor's rooms instead of going into hospital. You've got an evacuation benefit in Africa, and many more. Here are the contributions for 2023. Please note that this is for the 1st of January, and that the prices will increase from the 1st of April 2023. Okay, ladies and gentlemen, let's get to the exclusions. Exclusions is something to always be aware of, although on this plan it's not anything major. So we've got reconstructive surgery. That includes something like cosmetic surgery. In other words, it's not something that you necessarily need. Your bat ears and things like that, eyelid surgery, it's almost part of cosmetic. Breast reductions or enlargements, obesity, infertility, frail care, alcohol and drug abuse. And then I think where it's important just to take note, where there's a willful violation of the law, participation in war, terrorism, things like that, injuries that you obtained in a country during war, any experimental, unproven or unregistered treatments, and search and rescue is not covered. There are several additional value adds. So if you remember from Discovery as an example, you get 20% discounts for frames and lenses at an optometrist in your plan's network. So that's something that's just part of what you get. You also have access to Vitality, a great program to make you live a healthier life. So you can have a look at this. There are some interesting things here. Right, ladies and gentlemen, that's it from me at Key Wealth. I will post a link in this video where you can reach out to us. You can either book an appointment or you can click on a link to get a quote from our offices if you want to change options, look at an option, or anything that you need assistance with. You must have a great day, and thanks for tuning in for